I work in clinical education, focused primarily on the instruction of diagnostic ultrasound imaging. In this field, a combination of various learning theories and models are employed. I'm going to discuss 3 of these prominent theories. I work with adult learners. Andragogy is the theory popularized by Malcolm Knowles, which highlights the differences between adult and child learners. Adults are internally motivated to learn. They need to know the reason to learn something and are most interested in learning what has relevance to them. This often stems from their past experiences or current needs for their work or personal life. Adults are self-directed and want to make decisions surrounding their education. Collins, Brown, and Newman's work expands upon the Lavey and Wenger theory of traditional apprenticeship. This model of cognitive apprenticeship focuses on enabling learners to address complex tasks in diverse settings so that students learn how to apply their skills in variable contexts. One method used in cognitive apprenticeship is scaffolding. Learning is supported by an expert or more knowledgeable other and gradually removed as the learner gains proficiency. An example of scaffolding is when the ultrasound student performs components of a patient examination while supervised until they can complete the exam unsupported. Kolb's cycle of experiential learning is another learning theory relevant in clinical education. This learning process is cyclical and repeats as the learner gains knowledge, skill, and proficiency. Through reflection, the learner assesses the outcomes of their actions and determines how they will act in subsequent situations. The steps in the cycle include doing, observing, thinking, and planning. The clinical instructor works with the ultrasound student to facilitate the learning cycle. A patient encounter is planned in advance. The learner then experiences by performing the scan. When the scan is complete, the learner can reflect upon the outcomes and feedback. The theory acquired by the learner is used to put the findings of the examination in context with the patient history and plan the next encounter, beginning a new cycle.